let's be real. There's a lot of talk about sleep, but sleep in adults. And I don't know, I've heard Steve talk too, that they tell you we need to start looking at this at an earlier age, or that look at it in children. What that means is general dentists, as pediatric dentists, as orthodontists, this is an opportunity for you to pay attention to it. And I will tell you that your job as a dentist is to evaluate and identify. When it comes to sleep apnea, because it's such a broad term, and to come up with a diagnosis of that really needs to involve a sleep specialist. It's a medical diagnosis. So when we feel like that patient is close to that, we're going to get a sleep study done and diagnosed by the proper physician. From the sleep questionnaire, does the mother know they mouth breathe? But you're going to observe that by when you're talking to the patient, when you're examining them. Do you notice them drooling? Do you notice them mouth breathing by holding their mouth open? Or they're just sitting there with their tongue hanging out? When they speak and you're speaking to them, do you see an anterior tongue thrust? So that's what this is going to train to do. The other thing is the prongs are going to remind the tongue to stay back, and the lower lingual tabs are going to keep the mandible forward, and it produces mandible advancement. And then it'll tell you for post-retention, when you transition into the other appliance, how long they're going to do that. So my 9-year-old son that's done, he wears that hard appliance at night for post-retention. To ask them to put their tongue to the roof of their mouth and they look like they got a heart shape because that frenum is pulling down on it, well then we need to talk about that. To bring it up to the mother. Is it because they're not growing on their mandible fast enough? Is it a tongue tie? A lot of people may have a buccal tie too on the frenum, on the upper or lower, to look at that. We have a patient, we said, well, if this space doesn't close, this might be part of the frenum. We're going to have to snip that in the future. So she's got to exercise with her appliance. Okay? That's one of the reasons why you have freeway space, or why there's a space on the posterior areas, because maybe the patient's putting their tongue to the side or not in the right position. Number one, not to the roof of their mouth. So that's going to help guide that child. The other thing is the prongs. For if you observe an anterior tongue thrust, that's going to keep that tongue back. And if you ever wear one of these, you're going to notice when you try to put your tongue forward, it's your natural tendency to go, oh, that doesn't feel comfortable, and you're going to move your tongue back. But for children, they learn things so much faster than adults. That's why this is so successful. Okay? There's an up and down, there's an arrow to point up, and usually what we'll do is we open the plastic in front of them and go, you know what? There is this appliance that you're going to use, and it's going to help straighten your teeth, and it's going to help you breathe better. And there's a top and a bottom. So I'm going to let you tell me, which way do you think it goes up? And they are so bright. But what happens is, in the operatory, whether I'm sitting there or my assistant, they're like cheerleaders. They're like, oh, that's so awesome, you did it on your first try. They love that. They love that you are on their side. They love that you're excited about it. They're like, oh, I did something right. Because how many times when a kid does something wrong that affects them in a negative manner, you can't get them to do something right the next, you got to motivate them. So that's one of the ways that we motivate the kids in our office. The advantages of it, it's very little effort. So for that patient that likes to suck their thumb at night, this is kind of like a replacement, but it's actually not doing any damage to that lower anterior teeth or upper anterior teeth, or wherever they may position their tongue in the wrong position. We do find that we get consistent results. It's safe. They're not going to choke with it. I don't know if you mentioned it, but all the HealthyStart appliances are FDA approved, ISO certified, and they're antimicrobial, both the appliance and the case. Because the success of your case will depend on how effective you are as far as getting a commitment from the parents, getting a commitment from the child, and the compliance of both people, believe it or not. You know what this is. Something else can help them that is not prescription medication, that is not surgery. What if they had a habit corrector at night and that helped them get rid of the dark circles? Why wouldn't that be an option, a viable option? It is. It's just changing the way we think, change the way we've always thought.